Well, hello. How's everyone doing tonight? Welcome to Wellness Wednesday. Hopefully you've all had a great day and ready to be here to learn. And we're gonna discuss a pretty important topic tonight. Um, First of all, while I let everybody get on, and I hope everybody can see me and hear me okay. So if so, please give me a thumbs up or awesome. Okay, looks like everybody's jumping on. I think we're good to go. So I will go through my disclaimer first, as I usually do, and then we'll get started. First of all, anything that I say tonight during this Wellness Wednesday is just health information and is not health advice. Um, do not start taking or stop taking or change the way you are taking any of your medications. If you feel like you need to do so, please first consult with your prescribing practitioner so they can help you make the appropriate and safe adjustments. And by attending this Wellness Wednesday this evening, this does not establish a doctor-patient relationship. All right, so I think we are good to go. Got some thumbs up. How many of you suffer from indigestion or heartburn or reflux? Right, very common symptom. And how many of you gone to the doctor for these symptoms? And I know by the time you actually do go to the doctor for these symptoms, you've already tried one of multiple over-the-counter preparations, maybe even um, one of multiple home remedies for, taking care of these really uncomfortable symptoms. And you know what I'm talking about? There's Rolaids, Tums, Zantac, over-the-counter Prilosec. Many patients tell me that they do feel better after drinking maybe a glass of milk or eating some yogurt, or and of course now we know why dairy should be avoided. So these aren't really an option for symptom relief. Now usually, like I said, you go into the doctor for these, they tell you these symptoms are from too much stomach acid, right? So their treatment is to give you, medicine that blocks stomach acid production or that block histamine receptors on stomach cells that prevent the signal to produce the stomach acid, right? So GERD, is what we're talking about, gastroesophageal reflux disease. And they call it a disease, even though really it's just a symptom, right? It's a symptom of something going on, and we're going to talk about all those what could be possibly going on, those things to cause these symptoms. So there actually is danger in long-term use of these proton pump inhibitors, such as Nexium or Prilosec or and they have generic names like omeprazole or esomeprazole, or these are only supposed to be prescribed for a short time, yet they are the most prescribed of all medications, you guys. Okay, this is the treatment for GERD, but they're the most prescribed of all medications. So this obviously happens a lot. The label on these drugs says not to use for more than 2 weeks. Okay. But people end up on them for years. Now, I also know that if you're treating specific things, they might have you take them for a little longer, maybe 4 to 6 weeks, but that really is all that they should be prescribed for. This has a massive impact on a person's overall health and vitality. Why? Because stomach acid is an immensely important part of the digestive process. And it's crucial for the breakdown of protein and the absorption and assimilation of minerals from our diet. Okay. Extended use of these PPIs, or proton pump inhibitors, comes with a long list of very serious health issues like osteoporosis, immune system dysfunction, like autoimmunity, cancers, and Alzheimer's disease. As we grow older, the stomach becomes less efficient at creating hydrochloric acid, or HCl, as a factor that can result in a lazy or weakened lower esophageal sphincter. Let me explain. First of all, uh, a sphincter is a circular muscle that closes the stomach off from the esophagus. Okay. And if it opens prematurely, it's going to allow food, undigested food, or to go up from the stomach into the esophagus. And so the other thing that I think is necessary to explain here is this whole statement about when you get older, your stomach becomes less efficient. The number one reason for reflux symptoms is low thyroid. Okay. Your digestive tract, your stomach needs thyroid hormone to be able to produce the right amount of acid, to turn on the right amount of enzymes to digest your protein properly. Okay. All right. So, as a result of this, your stomach becomes less efficient at creating hydrochloric acid. And this leads also to a weakened lower esophageal sphincter. And that leads to the reflux. So the popular go-to treatment for acid reflux is with acid blocking drugs, right? This only exacerbates this already existing issue of low HCl. All right. Instead of conventional treatments, you guys, and in many cases, working to improve HCl levels in the stomach is an important part of the process of addressing GERD, right? An alternative explanation for heartburn, besides the typical acid reflux caused by this weakened esophageal sphincter, or what ultimately causes a weakened lower esophageal sphincter, it could be issues with stomach emptying or a hiatal hernia, certain medications, pregnancy, obesity, eating large meals, or even stress, which can all contribute to pressure on the stomach and potentially cause the stomach contents to back up into the esophagus through that weakened sphincter, leading to a burning sensation in the chest or heartburn. Okay, so let's think about these. So let's talk about, first of all, delayed stomach emptying. This means if your stomach takes too long to process food, it can put pressure on the lower esophageal sphincter, leading to reflux. Okay. Hiatal hernia. So this occurs when part of the stomach pushes up through the diaphragm. Okay. The diaphragm has and this causes stomach acid and really it's undigested food, not stomach acid, to leak back up into the esophagus. So there's a tight ring called Schlotzsky's ring in the diaphragm muscle. And think about what has to go through that. Your esophagus, yes. And then the stomach's underneath. Your aorta, the major blood, artery to your body. The vena cava, which brings blood, back from the body to the heart. And a very special nerve called the vagus nerve goes right down through that as well. So you can get many things that are happening when you have a hiatal hernia. And yes, one of them is some of those stomach contents can be pushed up into that and back up in the esophagus because there's just so much pressure going on there. This can cause trouble breathing because the vagus nerve gets pinched. It can cause racing heart. It can cause trouble breathing because of the vagal nerve input to those organs. It can cause, and that can cause dizziness and lightheadedness and just a lot of pain. It can cause trouble with digestive function too, where simply put, the stomach is not going to move food through as quickly when there's a hiatal hernia. Okay. All right, certain medications can cause this. Certain medications like calcium channel blockers, nitrates, some asthma medications can relax the lower esophageal sphincter, promoting acid reflux. Pregnancy certainly can do this because of the increased abdominal pressure, uh, can weaken and hormonal changes certainly can weaken that sphincter, leading to increased heartburn. Excess body weight, obesity can put pressure on the stomach, increasing the likelihood of acid reflux. What about larger meals? Yeah, eating large portions can overfill the stomach and put pressure on the esophageal sphincter. Stress, yeah, stress can exacerbate the digestive issues. Cortisol, can worsen acid reflux. This can cause the body to produce even a little more um, pressure. It's generally not going to promote more stomach acid because maybe a little more, but again, it's not necessarily the stomach acid that is refluxing into the esophagus. If that were true, because of the pH of stomach acid, it literally would burn a hole in your esophagus if it were just plain stomach acid. So um, now, when it's been mixed with a bunch of food that that you're trying to digest, it lowers the pH quite a bit, and then it will just be more of a burning sensation. But overall, guys, what doctors are trying to tell you is that this is too much stomach acid, and it is usually the opposite. Okay. It's undigested food that is getting pushed up into the esophagus through that tight sphincter, that lower esophageal sphincter, and it just is very uncomfortable. Food allergies and sensitivities or trigger foods which include like spicy or acidic foods and fried foods, like also maybe even nightshades like tomatoes. Um, Coffee is pretty acidic, and alcohol can do this, and even mints like peppermint. These can also cause trouble with food refluxing up into the esophagus. Now, some important considerations that we should discuss. We need to also be aware that other things can cause these types of pain. And so they can feel similar to heartburn. Women, especially, seem to have different sensations when it comes to maybe having a heart attack. Um, we need to they sometimes this pain sometimes comes with additional symptoms, right? So that we can identify the root cause better. So heart attacks or pulmonary embolisms, um, ulcers. Sometimes acid lowering is needed to help like an ulcer heal, right? So our stomach makes a protective mucus lining inside that protects the stomach from the acid. Otherwise, the stomach tissue would erode too very easily. Um, so this protective mucus lining um, allows the acid to be produced through it. It then helps turns on the enzymes in the stomach to digest your food, your protein properly, and then you have the issues. Then you can have you know the relaxation of the lower esophageal sphincter occur and get this reflux. Okay. Bottom line, GERD is a symptom. Okay, sign and symptom. That means something is wrong, and there's usually a thyroid or even an insulin resistance piece to it too. Because if your stomach cells are not able to utilize insulin and glucose properly as a result, then the sphincter will weaken as well. Um, Full and comprehensive testing is required to figure out what is going on with that, with your thyroid physiology and with blood sugar regulation mechanisms that would contribute to this. And it does it over time, plus many other symptoms that these cause. All right. Um, in the master classes that I give, I give free master classes usually about every quarter, and I will be announcing the dates of, you know, uh, um, upcoming master classes um, as they get closer. Uh, this is how, during these classes, I explain how to test for these things, what tests you need, why this is so important, and getting to the root causes, because this is the only way we can really solve this problem. Okay. Uh, Not going to get into treatment so much as it really varies and is so individualized for people. So I'll leave it there for you tonight. Um, I've gone a little over time with what I intended, so we won't do any live questions tonight, but put any questions that you have in the comments, and I will get to them as soon as I can. But again, it's so important that we understand this reflux issue and any symptom really that your body is giving you. Um, it's telling you something's wrong, something's off balance, and in order to really find out why you're having this symptom, you've got to get the right testing, which goes above and beyond what normally is checked by your doctors. And again, I go through and explain all of this during the master class. So you definitely want to tune in for that when we have that, and we'll be having one soon enough in the next. We'll be announcing dates here within the next month or so. But uh, that's how you're going to solve these problems. All right. Well, I'll leave it there. Thanks so much for joining us for Wellness Wednesday. Remember, ladies, there are answers. You still should be hopeful that you can find the answers and get the information that you need, and you still have the power to heal. All right. Have a great night, everyone. And be sure to put any questions you have in the comments so I can answer those later. Thanks and take care.